Hi, Darcy and I are both in red today. It is Go Red Day, and February is all about heart health. It is a time when people spend the month focusing on your heart health, particularly in women, and why this is something that is so important to talk about. The CDC says heart disease is the #1 killer of women, and it accounts for 1 in every 3 deaths of women every year. It's important to know the risk factors as well. What makes you more likely to have heart disease or die from a heart attack? Things like diabetes, being overweight, or having an unhealthy diet. Of course, we know smoking and drinking alcohol, not good as well. The CDC says about half of all people in the U.S. have at least one of these risk factors. All right, and finally, there we go. Having a heart-healthy diet is one way to reduce your risk. This means you choose low-sodium foods. You want to limit those pesky trans fats, the unhealthy kind of fat, and also you want to cut back on sugar. Doing all of those things will help your heart stay healthier for longer.
And thank you so much. As you mentioned, today is National Wear Red Day, aimed at bringing awareness to heart disease. Now, according to DHEC, deaths related to this disease claim more than 11,000 lives in 2020. News 19's Nate Stanley has the story.
It was hard.
It's been 15 years since Sanjanique Santiago lost her mother, Christine, to heart disease at the age of 62. She says it came as a surprise because of how active and youthful her mother was.
Heart disease is a silent killer. It will sneak up on you like a thief in the night.
Dr. Brendan Trexler from DHEC says heart disease is the leading killer in South Carolina.
We have a fairly high prevalence, fairly high rates of many of the risk factors for heart disease. Things like being overweight or obese, diabetes, or high blood pressure.
According to data from the department, more than 11,000 people died from heart disease in 2020. That's almost 2,000 more from 10 years prior. That data lists Marlborough, Darlington, and Lee counties with the highest death rates, while Beaufort, Berkeley, and Charleston had the lowest.
This is not just a disease or a cause of death in older people. It is still the 3rd highest cause of death for 25 to 44-year-olds, which I think of as really being in the prime of their life, and this is still the 3rd leading cause of death.
Dr. Lauren Holliday is a cardiovascular doctor at Prisma Health. She explains the key to prevention is being physically active and exercising regularly.
It's recommended to exercise at least 30 minutes a day, 5 days a week. Healthy diet is also extremely important, so making sure that you're eating healthy foods, mainly fresh fruits and vegetables.
She adds it's important to get screened regularly if heart disease runs in your family. These are all steps Santiago says she is taking and encouraging her family to take to avoid what happened to her mother.
I'm probably more up on my physicals than anybody in the family, and I push my children to go to the doctor to try to stay healthy. Take care of yourself.
In Columbia, Nate Stanley, News 19, WLTX.
Well, if you believe you are suffering from any of the symptoms of heart disease, doctors recommend that you reach out immediately and get screened.